Dandan, and from Fengxian District, Deputy Mayor Zhang Difang. From the Metro Group, Shao Weishen. And from the Public Transportation Group, Mr. Zhang. Now, first of all, let's give the floor to Zhao Dandan. Good morning, everyone. On May the 20th, there were another 84 confirmed cases and 784 local asymptomatic carriers. Among the 84 confirmed new cases, 35 were found in the quarantine centers, and 49 used to be the asymptomatic carriers. So, based on that, we analyzed that the newly added positive results amounted to over 800, and all the asymptomatic carriers were found in the closed loop. And for the severe patients, there are about 221 being treated in the designated hospitals, and 58 are dangerous patients. And one death case was found at 89 years old, female, with a lot of underlying diseases, for example, hypertension. And after being admitted to the hospital because of the stroke and myocardial infarction, she died. And by the end of May the 20th, we have found 930,597 close contacts, all in control right now. For the 3 asymptomatic carriers' close contacts, and their close contacts have proved to be negative after the confirmatory test yesterday. Yesterday, there were about 257 discharged patients from the hospitals, and asymptomatic carriers out of the quarantine centers amounted to 2,000, and they will return to their communities. Please be prepared for their return. According to our division of the 3 areas, and because of the combination of antigen test and nucleic acid test, on May the 20th, there were 2,329 contained areas with a population of 560,000. In the controlled areas, in the managed areas, there were about 2,000, and covering 1.97 million population. And there were about 58,593 preventative areas. Thank you, Mr. Zhao Dandan. Now let's open the floor to questions and answers, and please identify yourself before raising the questions. Now, line number 1. Thank you. From People's Daily. My question is to Shentong Group. There will be 4 metro lines to be in operation starting from yesterday. So how is the preparatory work done? And what are the quarantine requirements for the trial operation? And what is the plan of operation in the future? Starting from tomorrow, Shanghai Rail Transit Line 3, 6, 16 will be put into operation, and the operational time has ranged from 7 a.m. to 20 p.m., and there will be 20 minutes time difference between 2 metro trains. Recently, Shanghai Metro has been commissioning and disinfecting the trains, and we have done a lot of personnel training, and we've prepared some contingency plans so as to resume the operation of the metro lines. And starting from mid-May, we have the trains testing and stress test for several rounds in order to test the conditions of some key equipment and devices. Under the circumstance of the lockdown, we have some rehearsals for our personnel to guarantee the stability of the performance and so as to be prepared for the resumption of operation at any time. In addition to the operation of the 4 lines, the other lines are under preparation for some comprehensive testing and commissioning. According to the city's transportation disinfection requirements, before the end of April, we've already completed 505 metro stations, 30 bases, 8 command centers, and all the trains, air conditioning system, and filtering system disinfection. Right now, according to the requirement for the subway stations, we have already done some preparatory disinfection. For every one station, there must be one specific code. And we have already prepared those codes for all the subway stations. They must scan the code before getting on board. And for the standing positions, the safety points, the service centers, and the automated ticket selling machines, we have also prepared some code for those places. That number amounted to 12,000. And as to the personnel training, in our subway network, 7,000 people are staying online. We have arranged 1,500 people to return to their posts. For those staff returning to their posts, we've done the training, including the basic performance, the prevention and control training, as well as safe production and operation training. Since a lot of our personnel are staying at home, so we held online training. In addition, we also have formulated the contingency plans for the COVID prevention and control. And we have the local contact persons to guarantee their implementation. For example, if several people are infected or in the surroundings of the subway stations, there were some severe infectious cases, and there are some intermediate risky areas or high risky areas, we may close the subway station again or ground the train to a halt suddenly. And also, we dispatch the protective suits and N95 facial masks to the staff people to meet their medical needs, especially those in quarantine. If we found any case, we will register their information and transport this person in coordination with certain entities, and we will do the quarantine and the disinfection work accordingly. For the passengers, according to the containment measures, for the civilians to get on board the subway, they must have a green code and 48 hours negative test results, and their body temperature must be checked as normal. And they must also scan the code in the subway station. Outside of the station, referring to the entrance of the subway station, they must scan this code. And also for your information, the passengers, before entering into the subway station, they must voluntarily scan the code of this subway station and do not wait until the safety check. And when you are going through the screening, the passengers must actively showcase the green code just in case for the check of the staff. And only when you have the green code will you be allowed to get on board the subway. And as to the transfer lines, when you are transferring the lines, you don't need to scan the code again. For the elderly people and the vulnerable people, because of certain circumstances, cannot scan the code, you can also show the Baotong card or some transportation card and your negative result of the nucleic acid test within the last 48 hours. You can also get on board as long as you have the certificate from your community. And also when you are in the train, please wear your facial mask throughout this process and please coordinate with the body temperature check. Please keep some social distance from the other passengers and try to avoid a gathering of population when you are getting on and off the train. those are some of the reminders for the passengers once we resume the operation of the trains. And later on, based on the updates of the COVID situation in the city, we will try to add in more metro lines to be operated, and we will publish the information immediately to the public. Please pay attention to our Sina blog and our WeChat account to get some readjustment information. Thank you. Next question. Line number 10. From the Liberation Daily newspaper. Shanghai City's life is being resumed and the production is being resumed. So in this process, how to step up our safety monitoring? The question goes to Emergency Response Bureau. Thank you for the question, and thank you for your support of our emergency management work. Since the outbreak of the virus in the city, the municipal level and the district level emergency management authorities have been coordinating safe production and the prevention and control of COVID-19. We never drop the vigilance on safe production so as to ensure the overall stability of safe production. Not long ago, we took 3 major measures. First, for some companies that must ensure their supply, we must assess their risks on a daily basis. There must be safe dispatchment on a daily basis. For the firefighting safety, there must be immediate alert. And second of all, for the dangerous and hazardous chemicals and risk warning monitoring system, there must be some remote management of them so as to stringently dispel and manage those dangerous hazards. Third of all, to give full play to the third party, we organize the experts to convene some video conferencing in order to solve the problems of logistics, transportation, warehousing issues, especially for the dangerous chemicals. Now, many companies are at the stage of resuming production and operation. Safe production in the enterprises are still being challenged. For one thing, some employees, due to the COVID-19, have been away from their posts for a very long time, so they are unfamiliar with the safe procedures and they lack the awareness of safe production, so they are prone to violate against the safe production rules. For another, some companies are not having enough employees on their posts. The facilities and equipment are not being maintained and repaired according to the requirements. After the resumption of production and work, some enterprises might have to catch up with the time. So, those will give birth to some safety hazards. To promote the resumption of work and production, the Municipal Emergency Management Bureau, under the guidance of the Municipal People's Government and other authorities, we will do the following. First of all, a scientific assessment of the risks. For all sorts of risks, and sometimes the overlapping of different risks, the safety accidents may happen frequently, so we will focus on the prioritized places, fields, and links to give alerts about those hazards instantly. And secondly, we will try to hold certain people accountable for the implementation of the safe production. Because of the pandemic, there will be some new circumstances and problems encountered by the resumption of production and work. So we require different localities and different entities to be responsible for this safety issue when they are holding themselves accountable for the production, operation, and so on. One area must have one regulation, and there must be one specific plan for one specific enterprise. So we will categorize the safe production requirements and guidelines for different circles of lives. We urge the authorities and the enterprises to strictly implement the safe production rules, especially because of the need of the COVID-19 prevention and control, especially the supermarkets and some other entities. They must have a check of their firefighting conditions so as to have enough evacuation space once an emergency occurs. And there must be strict requirements of the power consumption. And thirdly, according to the State Council's 3-year dedicated plan of safe management, we will solidly have dedicated safe management campaign. With our actions, we will do our utmost to ensure the safety of the city operation and production. Thank you. Next question. Line 7. From the Economic Daily. My question is about the bus system. We know that the bus system in Shanghai is going to be resumed. So what are your plans about those lines? And what are the pandemic prevention and control requirements in the daily operation? And how to offer convenient services to the passengers? Thank you for the question. According to the arrangement of the Transportation Commission, the buses will be put into operation in 2 stages. In the first stage, it starts from the 22nd of May. We will resume 273 bus lines. And in our corporation, we will resume 111 bus lines to connect with the airport, train stations, metro stations, and the downtown area, the tertiary hospitals, in order to meet the traveling needs of the civilians. For the connection with the airports and the train stations, there are 13 lines. For Hongqiao Hub, the time difference between 2 buses must be no more than 90 minutes. And for the lines passing through the hospitals, there are 84 lines. The time difference will be no more than 40 minutes between 2 buses. And the civilians could come to our WeChat account for the operational arrangement. In the second stage, according to the Municipal Transportation Commission, we will consider the actual operation and the passenger flow of the buses in the first stage in order to readjust our arrangement. For example, there will be some addition in order to increase the capacity, in order to smooth away the transportation of civilians. After resumption of the bus lines, according to the pandemic prevention and control requirements, we will do the following work. First of all, before the 22nd of May, for the 111 bus lines, their stations, the air conditioners in the buses, we will do the disinfection. Secondly, there will be antigen test for 2 times per day and 1 nucleic acid test for all the staff members on board of the buses. And there will be the body temperature check for every route traveled, and they must wear facial masks and the gloves. Thirdly, for the buses in operation, there must be disinfection per day, and there will be continuous ventilation when they are in operation. Fourthly, for the waiting spaces, there must be disinfection every 4 hours. We will regularly pin on those pandemic prevention and control posters on the bus stations, and we ask for our civilians to coordinate with the containment measures. For example, green code, 48 hours of negative nucleic acid test results, and body temperature check, and please actively scan the code of our bus and wear your facial masks throughout the journey. And our bus corporation will set up 1 code for 1 bus station. We have also put on the place code in all the buses and bus stations, and we hope that our civilians will be coordinative in scanning the codes, and there will be the voice alerts about the arrival of any bus stations, and there will be some on-site personnel of the buses to guide our civilians to scan the codes. According to the Transportation Commission's requirements, considering the containment measures when they are getting on the public transportation. For the disabled and elderly and other vulnerable groups, they can also take their Baotong card or the transportation card with their identity information or the certificate of the negative nucleic acid test result within the past 48 hours to get on board. Thank you all for your coordination. Let's safeguard the safe, orderly, and healthy traveling experience. Thank you. Next question. Line 22. Thank you. From Caijing News, my question is to Fengxian District. The stress test has been going on for days, so what is the result of the stress test and how to consolidate the achievements of pandemic prevention and control? Thank you for your question. Fengxian District has been committed to the dynamic zero-COVID policy since May the 16th. We have gradually resumed our production and work with our stress test. There is a project called 4+1. We hope to orderly open our district to the normal life and work. There are some standardized scenarios for our stress tests. We hope to initiate the full functionalities. Especially we look at the public functionalities, for example, the buses. On every bus, there is one dedicated person for containment measures, and we have centralized the management of the staff. The passengers must wear their facial masks, scan the code, and have body temperature check before getting on board. Line bus lines have been tested, and we hope to meet the needs of medication and the traveling of the civilians with the 9 bus lines. Tomorrow, we will resume 68 additional bus lines. Secondly, we will open the parks. Because of the population flow restraint, for every park there must be one contingency plan. We have opened Shanghai Zhiyu, Wuhua parks, including Dihai Jingsha. We have opened 7 parks and scenic spots, receiving 20,000 visitors, paving the way for gradually opening all the parks in the city. Thirdly, we open the public spaces. In the whole district, there are 13 neighborhoods and the community service centers and offline service windows being opened gradually. We have handled 3,400 different items, and in the hospitals and the health centers and the clinics have basically been in operation right now. On a daily basis, the inpatients number has been about 73% of the number last year. And we have opened the public supermarkets and shopping malls with the code of the places and other stringent measures, for example, the scanning of the code and certificates, those convenience stores, pharmacies, the beverage shops, and the fresh markets have been gradually opened. In the project of 4+1, the 1 means there is one red line for us to relieve the measures with the vaccination, the TCM intervention, and nucleic acid test, and multiple measures. We will try to prevent against any rebound of the virus. In general, by focusing on the doorsteps of the residents and the public spaces, And with our 1,200 nucleic acid test stations, our civilians feel it very convenient to take the test, just like online shopping. In the future, we will step up the vaccination work, especially among the elderly population, so that we could set up a more solid firewall of immunology. And as to the sanitation, public transportation, delivery services, we will offer the TCM intervention as a method to help those service people. And we also take the grid as a unit to hold the certain people accountable. And we basically cover all the grids in terms of the QR code. Of course, as to the inconvenience of scanning the code by the elderly people, in some neighborhoods, we have seen the gathering of population by scanning the code, so we will try to dispatch some volunteers to keep those lines in order and improve the services. Thank you all, our civilians, for your support and your understanding. And I also ask for you to not drop the vigilance of the containment measures, to consolidate the hard-won achievements, and please adhere to all the containment measures to protect our healthy lives. Thank you. Any more questions? Line 11. I have a question to Zhao Dandan. Could you please introduce the current daily number of patients in the hospitals? Thank you for your question. In May, the outpatients in hospitalization numbers have been climbing up gradually. In addition, except the designated hospitals, 23 medical institutions have opened their outpatient services, resuming about 40% of the number of last year. For example, in the Sun Yat-sen Hospital, the first hospital has over 10,000 outpatients on a daily basis at the peak time. In Huashan Hospital, they have received about 80% of patients of last year. And 1,900 operations are being carried out in the whole city per day. And as to the transplantation of the liver, Huashan Hospital has conducted such complicated operations even on the infants. Some very difficult operations are being done in the major hospitals in Shanghai. For the district-level hospitals, they have also contributed greatly. Their capacity has been gradually resumed. In Sun Yat-sen Qingpu Hospital, the daily outpatients numbered 6,000. And the community clinics and health centers have been put into operation as much as possible to guarantee the basic medical needs of the civilians. Right now, in the contingency plans, a large number of medical practitioners are being sporadically scattered in the makeshift hospitals and designated hospitals. All sorts of medical institutions have readjusted the outpatient time from Monday to Saturday to ensure that the patients could receive immediate help upon their arrival. And also, Sun Yat-sen Hospital has resumed the outpatient services even on Sunday. Previously, because of the pandemic, some operations have been postponed. Now, the hospitals are carrying out their daily operations, and they are adding the number of operations on the weekends so as to do as many operations as possible, especially those that have been postponed beforehand. And also on Sunday, there will be the counseling services for free online. And this Sunday, the first counseling service will be online, and Mingguang Hospital launched these slogans in their lecture. In the future, for the childcare and mental health, TCM, the oncology, prevention and treatment, and cardiovascular disease, there will be some specific lectures. While carrying out the regular pandemic containment, we must be prepared for the treatment of the other diseases. So, to remind our civilians, please coordinate with the pandemic prevention and control measures when you are receiving medical services in the hospitals. Please take your body temperature and wear your facial mask, keep good hand sanitation, and scan the code voluntarily. I believe with the efforts of the medics and the patients, we will very quickly resume our medical services. Thank you. Dear media friends, if you have any more questions, or if you have the need of interview, please contact with the information office of the Shanghai Municipal People's Government, and we will give you the updates later on. This is the end of today's presser. Thank you for watching.